Hi out there. Good to meet you on this platform again. This is Drug Addiction and Substance Abuse Management Series number 5. I'd like to share with you briefly addiction management and early diagnosis. How do I sort and spot an addiction case? And what are the early diagnoses as a therapist or as a health giver, a counselor, a parent, a ward, whatever designation in the space of care? It's very vital you know what to do from ab initio. I'd like to share with you two basic models that can help. The first model in diagnosis is what I call the 3S equals to 1I. I say it again, 3S that delivers 1I. What's the first S? It is situation on ground. What's the second S? It is solution at hand. What's the third S? It is the strategy required by which you connect solution at hand to the situation on ground. Now let's talk about them one after the other. Oh, you like to ask, what about the I? Yes, the I stands for intervention. In other words, when you have a situation on ground and a solution at hand, with the strategy required to connect situation with the needed solution, you have an intervention there. So every substance abuse addiction case must pass through these three phases to procure an intervention. It's not just about surface counseling to say, it's not good, don't do it again. On very many occasions, the victims are helpless. Many will want to come out, but they don't know the way how. They don't know what to do. And it is because addiction itself is an extra life, parasiting on the original life of an individual, whether young, middle-aged, or the aged. It is the same ball game. So let's look at them one after the other. What is the situation on ground? You need a facility to be able to understand what situation is right before you. As a caregiver, as a therapist, what is this case all about? What you don't understand, you cannot appreciate or manage. And when you cannot manage, as we popularly say here, then you will cause damage in an attempt to package. So it's better to know how to package in order to manage and avoid the damage there when you come by a case. So it is always a situation on ground. Why do we call it situation on ground? It has the capacity to ground the victim, the one suffering that malaise of addiction and substance abuse. So what is the situation grounding this life, this persona? What is making him to be down? How has the drug he has abused bringing down his essence even when he is present? So what is the situation on ground? Find out. And I'm going to show you how to find out. Don't see it up. An individual you see up as a therapist or coach, you can never help while you are down. It takes somebody who is up to be able to support the one who is down. So that's why we call it situation on ground. What's the second case scenario? It is solution at hand. Not solution in the head, not solution on the soldier, not solution at heart, not solution in the brain or in the mind. Before it even becomes solution through your mouth, it has to be handy for a solution. Why do we call it solution at hand? On very many occasions as caregivers, we know what to do, but we don't know how to do it to get the best outcome, optimal result. Often, the solution we have is in the brain, is at heart. So we keep wishing. And if wishes were horses, even beggars will ride. You need the facility to be able to pull out from yourself the timely and appropriate solution to that situation on ground. So that is why the solution you are going to procure, given who you are for what you know and what you want to do, must be handy. It should be a solution that is handy. You can handle it. And anything you can handle, you can always tweak with it. You can apply it. Not just in your head. It must be the right one that is in your hand, ready for use to tackle and to confront the situation on ground. So it has to be handy. It has to be one cut out from the vast resources of knowledge, competency, and the capability that you have. In fact, competence is not enough. You need to also be capable. And the difference between competency and capacity or capability can be seen in your own ability to use what you know to solve the problem, the challenge on ground. Don't see challenge at hand. See it on ground so that you can go there to the ground, examine it as a therapist, as a parent, as a social caregiver, and deliver right there from ground. And then what is the third S? It is the strategy required. The immediate thing you need to do, what to do later, and what to do on a permanent note to ensure that this individual no longer goes back to that addiction. So how do I get the strategy required? As long as you have and you have been able to route and see and understand the situation on ground and the appropriate solution at hand, of course, you will know what to do. You will know the best option that will yield optimal outcomes, given the case on ground. So on a very pivotal note, it is so exciting to know that understanding the two ends, the one on ground and the one on hand, is your first pivot to knowing what to do and how to go about doing it as far as the solution meeting situation is concerned. So the situation on ground must meet with solution at hand through strategic delivery of the solution. And in strategy, you are able to align knowledge into service delivery. You are able to meet demands, giving what you have to supply in the place of outcomes and answer. So when you have these three S working together, you are going to likely have an intervention in the case that is before you as a caregiver. That is the first model. The three S that delivers your one I. Situation on ground, solution at hand, and the strategy that is required. The three deliver intervention. What is the second model I like to share with you as a caregiver in the issue of addiction, substance abuse, across the borderlines? It is the IDEA method or the IDEA model. By acronym, IDEA. So what is the I? It stands for identification. You need to be able to identify with the case on ground. What is this situation all about? Take the necessary information from people around, the victim, the person needing help, the vulnerable. Hear from him if he's conscious. Besides hearing from him, you also need to find out from people around him. Oh, for how long has he been into drugs? This bad behavior happening in his life. How long? Take your early diagnosis, giving whatever report you can get for an information. That is very important in handling the case of addiction. There's no one size fits it all. So identify. As a therapist of repute, we have frameworks we have created for other therapists like you, parents, guardians, and families to be able to find out basic issues on a preliminary level about a drug addict or somebody needing psychosocial support or help. That I can send to you for free if only you will make a request. So the first letter in IDEA method is letter I, identify. Identify the case, and then very pivotally, I must say this, identify with the patient, himself or herself. Don't just say, oh, uncle, you see, your boy is bad, your boy is doing, you are a quack and not a professional. You need to be able to identify the case and then identify with the individual who needs your solution as a therapist. And that is where compassion will come out. That is where the capacity and the quotient to care for that individual will come out. So that is letter I in the IDEA method. The second letter in the acronym IDEA is definition. As a therapist and one who has been coached, you should be able to now come out with your point blank analysis of what the case is per se. We have trained a couple of people here and there on drug addiction, substance abuse, and you see, and we've given frameworks by which you can decipher and know exactly what case of addiction is. So you need to be able to define and point out, point blank, oh, this is addiction to porn, addiction to drugs, addiction to this and that. And that will guide what assessment you are going to run. That will teach you and tell you which way to go, because something you have identified, but you cannot define. You'll be beating about the bush. And as a chief consultant and therapist who have trained so many across board in this line, we can also supply you for free some of the facilities you need that will help you define a particular addiction, so that you know the root cause analysis, you know the point blank analysis, you also know the trend analysis and the structural deviation. So you need to be able to do definition. What about letter E of the model idea? It is called evaluation. Once you are able to identify and define, you have what you need to evaluate. This is where you place all your cards on table as a caregiver to say, sir, ma, given this fact before me, this and that is what is happening. And these are the solutions coming out for it. You evaluate. To evaluate means to appraise the situation on ground and see the solution you have at hand to mitigate it where you cannot eradicate immediately. And then you draw out a Marshall Plan, given the evidence-based report you have just generated through your knowledge, through the information, and through other observation you have made. And I like to put this especially for people who do online therapy, social media therapy, and all of that. I get results, whether online, offline, or on-site. You need to be able to see face to face, have eye contact with your client, whether by social media or by physical contact. You need to be able to see the emotion that surrounds him or her that you want to aid and help out of a situation. So very vital. Do your evaluation, whatever method you are using, make sure it is that evaluation that is able to offer immediate solution to what the situation is on ground. At least to know what to do and to begin to want to start doing it. That is letter E. And the last of it is A, administration of solution, which we call therapies. You need to do therapies. Now, in the African climate, once people hear therapy, they said, over my dead body. Often we see the word therapy as if it's something bad. No, it is simply the capacity, the art and science of offering solutions to situations. There's nothing bad about therapy, and you don't need to wait until things go there wrong before you ask for therapy. So therapy says you have a situation on ground. It could be the good, the bad, or the ugly, and here are solutions to make it better, brighter, bolder, and bigger. So that is why at times when I want to meet with cases, maybe of an addictive behavior of a young lady out there, a young boy out there who doesn't want therapy, who doesn't want to see a doctor, who doesn't want therapies and all of that, they just chicken out. So I tell the parents, please don't call me doctor. Don't call me therapist, even though I am. Call me efficiency coach. Call me productivity expert. Because what you do in therapy is to help people to be productive. Is to turn bad situation to good situation and good situation to a better one. So, very vital. Evaluation must be done. Carry along your client and the sponsor. Let them know what you are going to do and why you are doing it. It's very critical. The issue is not about money, but it's about making meaning and contributing value to sorting out an issue before you. So what is the final letter? Letter A. If you must engage with somebody who is into addiction, it is administration of therapies. So break it down. Like I said, these are the seasons, these are the moments. Find out what is convenient for your client and the people around your client. Very vital. Please, you have to dance to the tune of your client because of the situation on ground. It's already grounding your client. Find out what is convenient and be compassionate enough to know that you are delivering service. A therapy session in Cyber Resources Intervention Hub is usually an hour. So in Cyber Resources space, where we handle the good, the bad, and the ugly, we draw out a Marshall Plan to outline for you the lines of therapies. And in therapies, we also run some reality checks. We'll let you know these are the number of checks we are going to run to be able to ascertain what we call the degree of vulnerability. We want to be able to know how deep and intense is this case of addiction. Is this just surface, mild one, or the one that has incubated over a long time? So we need to run some assessment, not just a checklist. No, we do behavioral invasion, which is the next topic we're going to handle in handling addiction. So it is there we determine what fee we go into it, the checks, and then the sessions and the follow-up. So what have we done in this episode? I've shown you as a caregiver, as a parent, as one who is concerned about a particular case of addiction, porn, drug addiction, substance abuse, character addiction, lifestyle deficit addiction. You need two basic models, the 3S that delivers the I, and then the idea model. I hope you pick a lesson or two today. You want to reach me? Oh, feel free to reach me. I'm Dr. James Komolafe. I'm a forensic psychometrician and chief therapist at the Cyber Resources Intervention Hub. You can reach me on +234 8035 999 220. You have any case of addiction around you or with you, please put a call through today. And you want to take this course, very simple. You post the video to you wherever you are in the world, and then we can engage and sort out our communities. You know what? Addiction is a malaise, a behavioral disease that can be spotted and sorted when you know what to do. We know what to do and are helping many to walk away from it. Thank you so very much. See you in the next class, and bye-bye.